Our first speaker for this afternoon is Dr. David Kennedy. Dr. David Kennedy received his BA in Biochemistry and Physiology at the University of Kansas. He graduated from the University of Missouri at Kansas City Dental School in 1971. He is retired from private practice. He is president of the Preventive Dental Health Association, a past president of the IAOMT, and chair of the IAOMT Public Relations Committee and Fluoride Committee. Please give a warm welcome to Dr. Kennedy.
And thank you, Janet, for that nice introduction. I do not have any financial interest of a product in my talk or any of the companies that I'm going to make fun of are offering grant monies for this continuing education or medical education program. No, I don't get any money from these guys, and you'll probably find out why shortly. But I agree with Murray that we've won. We've slam dunk won. And so I'm getting ready to declare a victory. And here's one of my victory pieces.
I just had one question. This is not necessarily for you, actually. It's the one I picked out of the parade of doctors, but anyone can answer this question. It's specifically the baby issue and the baby formula exposure issue. Can someone address that, if there's data on that?
I'll answer that.
I heard your view of it. I just didn't hear the opposing view. And then say which doctor you are when you...
Okay, I'm Howard Pollack.
Okay, go ahead, sir.
I'm at UCSF. Your question is with the baby issue.
There's a concern that the level of fluoridation was too high for babies to drink.
Right, and you know, the American Academy of Pediatrics recommends breastfeeding for infants. However, the majority of children are not breastfed. And you know, ever since time began almost, there's been alternatives to breastfeeding. So we recognize that with increasing knowledge and science base in terms of fluoride intake from all sources, that young infants, when they are receiving powdered infant formula or formula that's concentrated and has to be diluted with water, that young babies will receive a lot of water. And some will receive higher than what is considered to be the tolerable upper intake, whereby after in excess of that, there's a chance of developing dental fluorosis, white streaking of the teeth, as those teeth are developing. And so this guidance was issued, as you've heard, to provide information so that risk can be balanced with the risk for tooth decay when considering what kind of feeding practices should be used for infants. If infants are using the ready-to-feed formula that doesn't need dilution, then there's no issue. So that when using an infant formula that needs to be diluted, we're recommending using distilled water that is available at stores.
So you'd recommend distilled which has no chemicals in it?
That's correct.
Okay, excellent.
Recommend distilled water. And now back to our victory celebration. That all the dental organizations now admit that if fluoride works at all, and I'm putting a question on whether it even works topically, the benefits have to be topical, and the reason they say that is because every other possible mode of action has been disproven. So they're down to the last remaining theory. It hasn't been proven to work topically, it's just their last remaining theory. And who's saying this kind of radical stuff? almost 8 years ago, the Morbidity Mortality Weekly, the Center for Disease Control, in their recommendations says that the caries in the population is not related to the concentration of fluoride in the enamel. So you heard how when you were in dental school, fluoride made the enamel stronger? It doesn't. It makes it weaker. It makes it porous. It makes it more prone to tooth decay. And higher concentrations in the fluoride in the enamel are not necessarily more efficacious in preventing dental caries. And recent laboratory studies and research indicate that fluoride's predominant effect is post-eruptive and topical. That means it can't have any effect on the gums because it just doesn't go that far into the tissue until it accumulates in the bone. And topical means, you know, like sunblock. You put it on the skin, you don't swallow it. And then they went on to say that saliva is really where you want the high levels of fluoride. And that means that, you know, if you brush with the toothpaste that's high in fluoride, like Crest or Colgate or something like that, you can poison the poor little germs that happen to be stupid enough to hang around that tooth. And that's how their current theory of fluoride's action on preventing tooth decay. But what they didn't mention is that, you know, it may also have some other side effects. But the amount of fluoride that comes out in your saliva, even if you're poisoned nearly to death, is not high enough to have any measurable impact. This is these radical people saying this. And here's this other organization you've probably heard of. I was a member for 35 years, and John Featherstone published an article in 2000 that says, you know, the amount of fluoride in the enamel does not affect solubility. You know, you heard how, you know, that fluoride in the enamel, we find it in the enamel so it keeps the enamel from dissolving. That's how it works. That was a theory. And so, as I was explaining yesterday, the difference that Socrates taught his students to know was the difference between truth and opinion. And that opinion is where evil entered society, and it changes like the wind, and truth was always the same. You know, it was like the North Pole. It was always going to be north. You see that we've had quite a few shifts in the wind on the theories, so we can substitute opinion for the word theory. So it's the opinion that it might have an effect this way or that way, or some way or another way. And the amount in your enamel, you can have enamel that's up to 1,000 parts per million. That's the same level as Crest. So your sparkly little tooth can be as high as Crest, and it has no difference in solubility. So that means there's no way that it can have a beneficial effect. So that's really too bad. And then you can have it built into the dentin of the tooth, and that doesn't have a beneficial effect either, except it does tend to make the dentin a little more fragile. And so I have some new colleagues that have joined me in my efforts to protect the children of our country from this intrusion into their diet with a hazardous waste from China and Mexico and Florida. And one of them is Bill Osmondson, and up in Bellevue, Washington. He's been quite vocal. But he was promoting fluoridation 4 years ago. And so, you know, he used to be the golden boy of fluoridation. And then, like many other people that can read, he changed his mind. And, but one of the slides he uses is what they call a consensus development conference. And what I call it, that is a kangaroo court. Is it, how can you have a consensus development conference if you don't have anybody that disagrees with you at the conference? And every single speaker at the conference has a very big conflict of interest. I would say that would be what we call a bias consensus conference. But anyway, it says for only 2 specific applications, the fluoride varnishes and carries high-risk caries individuals, and fluoride-based interventions for people receiving radiotherapy was the evidence related as fair. Oh, gee. That means all the other evidence was worse. So what's fair mean? Fair means that you would get a C. And that means that there is no high-quality research showing, even in these 2 narrow little tiny points, is there any evidence of benefit. You know what? I bet you there's barely any evidence of benefit for these two. Because fair means to me that it was a biased research that didn't control for other variables done by somebody that was working for some other organization. And fair, I don't think that's fair. I think that's a perfect example of what the problem is. And so we go to our missing member today. You know how when you lose a plane in battle, you have the missing man formation? Well, Griffin Cole's got an anniversary, so we got Griffin Cole's missing. But he's a good guy down in Texas, and he got on this fluoride varnish issue and did the work that any of you guys can do. He got on the phone and started calling his suppliers. Say, I got this fluoride varnish. I'd like to know, what year it was patented, and send me the research as you submitted it for the patent. And it comes back is that all that's ever been approved is the Copalite varnish. Anybody old enough to remember what Copal resin was? You know, the gum of a copal tree that they mix in a solvent, usually alcohol, and you dissolve that into the dentin, and it's supposed to keep the tooth from turning black from your amalgam. Gosh, is there any fluoride in copal resin? No. They didn't approve it as an adulterated form, but then the companies added 50,000 parts per million fluoride to the copalite resin. It's an adulterated product. It's a product that can't legally be on the market. And they don't know how much dose of fluoride that gives to the individual that received that. They don't know what dose of fluoride went to the soft tissue around that intervention. And they don't know what the systemic effects of this fluoride are because it's approved by the dental division of the FDA, who required no proof of any of the adverse effects of fluoride because it's not within the purview of the dentist. But you know what? It is in the purview of the manufacturer. This is a time-release poison painted on children's teeth. And it's a tragedy because here we are in 1977, Congress ordered the National Toxicological Program to study the carcinogenic effect of fluoride. And they didn't get that job done. It was a 2-year job. They didn't get it done in 2 years. They didn't get it done in 10. In 1989, the high-dose animals were awash with disease, and they had cancers of the lip, tongue, throat, liver, and bone. You see that path there? Wherever where it touched. Well, what horrible high dose did they use on these poor little rats? The American Dental Association says the rats were definitely overdosed. Oh yeah, they used 79 parts per million fluoride. Well, we just talked about Crest being 1,000 and Colgate 1,500. So those unlucky little rats that had to go have a little sip of water a couple times a day, or kind of like those unlucky little humans that have to brush their teeth a couple times a day because their dentist recommends it. And so they had a conference, and the very people that Congress did not trust to do the toxicological study, the United States Public Health Service, a very good name, a very bad reputation. They're the military. They wear uniforms. They follow orders. Changed every single cancer. If I had cancer, I would want to see one of those doctors, because what happened was every single cancer these little rats had went away. They had a cancer of the bone. It was so big, they said, oh, that's so big, it should have killed the rat, so it can't possibly be the bone cancer. They had cancers of the liver, and they said, well, it just looks like a benign tumor to me, and had the carcinoma in situ of the lips. Oh, no, that's just chapped lips. That rat's got chapped lips. So every single cancer went away. And so that's what they're doing in Washington, D.C. to protect the health of the children. And that everybody admits that fluoride causes fluorosis. And that what they also admit is that fluorosis, thanks to the recent National Academy of Science review, is that fluorosis is not only a systemic effect, but it's an adverse health effect. And it's the systemic inhibition of the enzyme essential for removing the enamel matrix proteins called a metalloproteinase, and it's poisoning the enzyme making the tooth. Well, if you're going to poison the enzyme making the tooth, do you think maybe you're poisoning the person that's attached to the tooth? And so here's your graph of dental fluorosis. And that if you were a lucky person to be in San Diego or something like that, already 14% of the kids have dental fluorosis. And then, you could go on up to 0.7, and then you have 22% of the kids. And then at the recommended optimum level of fluoridation, you have 30% of the kids with dental fluorosis of 2 teeth. And then it goes on up from there. See that? That's called a kind of a linear relationship. But you notice it doesn't go down to 0. When the water fluoride is near 0, it still doesn't go down to 0. But how did they get the numbers down this low? They took the kids that had 1 tooth that was damaged with fluoride and threw all that data out. Well, it's just 1 tooth. Who cares? Your friends call you Fang. And so then they took the kids with 2 teeth, and one tooth looked really icky, and the other was just kind of icky. And they said, well, this kid has kind of icky dental fluorosis. So they took the lesser of the 2 classification. Now, when you talk about it, so if 25% of the tooth was, 25% of the second tooth, the whole tooth can be 100%, of the second tooth, 25% of that was very mild. Now, if I scrape the skin off all of one side of your face and 25% of the other, I would say that's a very mild scratch. And if I do half the tooth, it's mild. Let's see, if half the tooth is mild, the whole face of the tooth is moderate. Well, it looks like we've kind of used out of our classification. What are we going to do for severe? Oh, pieces of the tooth missing, that's severe. Well, I kind of agree. If parts of you are missing, that would be severe. So this is very mild. And she's a model, and she didn't like having mildly goofy-looking teeth. And there's very mild again. So very mild is very good for business. Cosmetic dentistry is the largest growth industry in dentistry. Dental income goes up in fluoridated communities. Bleaching centers go up in fluoridated communities. So it's a good thing. And here's, so Howard Pollack in 2008 has now acknowledged that what Levi published in the Journal of the American Dollar Association in 1995 was correct. If you put the baby on a bottle, it's going to get dental fluorosis. So, at that rate, I think we need to declare a victory immediately, because if we wait for them to declare a victory, it took them 13 years to acknowledge the obvious. I mean, just to calculate the dose. The dose is well above the one that the EPA says is going to cause harm. Of course it does. And says, this is the ADA's recommendation, is if you want to avoid fluorosis. I don't know why you would not want to avoid fluorosis, but unless you were a dentist child or something like that. They just limit it to the first 12 months. And then this is basically what Howard was saying, that breast milk is widely acknowledged to be the most complete form of nutrition for infants, and then they came up with this figure. This figure is much higher than breast milk that I've measured, so it's, we do have bumper stickers for people who would like to acknowledge the presence of a sort of tragedy, actually. If you look at our country, if you look at what fluoride does to the children, it doesn't make their teeth look funny, it makes their brains act funny. And you're going to hear from Dr. Mullinex, her brain acts a little funny too. She doesn't think it's a good idea. But, so if you can poison a child systemically so their teeth look funny, what other things do we find are maybe not so ha-ha funny, but funny? That would be bone. Fluoride accumulates in the bone. And on the National Academy of Science Committee, Hardy Lineback shared with me that he actually argued Kumar and his friend into actually calculating the dose that those little cells are exposed to when the baby tooth is being exfoliated by the permanent tooth. As the permanent tooth comes up, the bone dissolves, and as the bone dissolves, the permanent tooth comes in. And it's been shown almost for 60 years now that the children living in fluoridated communities have the eruption of their teeth at a later date. If you've seen my video, Poisoned Horses, there's a 4 or 5 year old horse that's still got his baby teeth. That ain't right. But why would that happen? And Leonard Kruk, when Jeff Green and I conducted the IAOMT risk assessment in San Diego in 1998, explained in some detail with some excellent slides, if you like to look at histology, of why that occurs. And it occurs because the cells that would normally dissolve bone die. And so there's nobody to move the bone out of the way for the permanent tooth to come in until the body scuffles around and gets some stem cells and makes some more and brings them in there. So those teeth are coming in late in cattle, in horses, and in children. So, gee, what level of fluoride are those cells being exposed to? It's 6,000 parts per million in the area where the bone is being dissolved. 6 times higher than crest. And you know how it says keep crest out of the reach of children? Why is it that high? It's because the children's bones have become saturated with fluoride because of our introduction of this chemical to the water supply. Go to our website, the children, and it has Kathy Thiessen's excellent presentation on there about National Academy of Science determined using very conservative numbers, using only the numbers of people that actually drink the water, you know, because some people have bottled water. I noticed that you guys have bottled water. She didn't consider other sources of fluoride, such as I noticed when we come to the Academy meeting, they invariably serve iced tea, which is very high in fluoride. So I respectfully declined to drink the Lipton iced tea. But there are many other sources of fluoride using only water. And only people that drank the water, you can see that there's a substantial percentage of the people are overdosed. And what's interesting is it's not fluoride they're putting in the water. And here's where the money comes in, is that if you're going to put something in the water, the stuff has to be really, really cheap. And so they can get it from China because China takes it out of the water. So they don't want to put it in their water. So we're buying the stuff from China, Japan, Mexico, and Florida. We used to get most of it from Florida, but then we had a little trouble with a hurricane, and that kind of reduced our local supplies. It doesn't reduce tooth decay, and that's the big bugaboo, because remember we had FAIR for the 50,000 parts per million fluoride. I mean, if I could put 50,000 parts per million arsenic on there, you'd get a reduction in tooth decay. You know, this is stupid. 50,000 parts per million is an enormous amount. So that's FAIR. So all of the broad-based blinded studies where you control for the age of the child and don't look at 8 years old, because there is a difference at 8, because there's a difference in the number of teeth. But if you look at in the permanent teeth, you look at 18, there's no statistically significant difference in tooth decay. In the broad-based blinded studies, 39,000 in one study, over 400,000 in another. So it's basically a scam. It's a fairly large scam. And you know who's going to get the hoo-hoo when it hits the fan blown on them? It's not going to go toward the people scamming. United States Public Health Service, Center for Disease Control, American industry. It's going to come on our shoulders. And so I'm telling everybody is that what you want to do is get out in front of that truck so it doesn't run over you, and get way ahead, because it's going to run over your colleagues, because you took a position that was morally and ethically correct, and we declared a victory. It's not safe for a baby. I mean, do we have to wait till it's not safe for grandma too? Well, it's not, but you know, I'm good with one. It's not safe for a baby on a bottle. The level, and so here's worldwide data from the World Health Organization. It doesn't reduce tooth decay. Can you tell me which countries in that graph are fluoridated? No, you can't. But the dentists like to ascribe a cause and effect relationship to a trend. So tooth decay has trended lower in this country and in Belgium, Australia, Denmark, Finland, France, Germany, Greece, Iceland, Italy, Netherlands, Norway, Portugal, Spain, Sweden, Switzerland, and it went up in Africa. So, gee, I guess that maybe they can afford more candy now. But, so, it would be just as logical to say, well, fluoridation is responsible for this decline in tooth decay. And I could say, well, I think it's also responsible for more televisions and cell phones for sure. Because over the last 50 years, there's been a tremendous increase in televisions and cell phones. And that you've been adding fluoride to the water. Yes, I think fluoridation causes televisions and cell phones. The data speaks for itself. So here's the the one that Bill Osmond's been kicking about, and I have too. We filed 3 petitions with the FNDA for over the last 20 years. They have yet to take action on any of them. Jeff Green got this congressional investigation going in 1999, and Ken Calvert, congressman from California, agreed to ask some questions that Jeff crafted. You know, it's one of the things that's taught in communications. It's not the answer, it's the question. And it's not the first question, it's the follow-up question. So first question is fluoride a drug? And the FDA says, yeah, sure. When it's used to diagnose and treat, yeah, it's a drug. And have you approved any fluoride-containing, follow-up question, have you approved any fluoride-containing substance intended to be ingested for the purpose of reducing tooth decay? We couldn't really prove it because there's no new drug applications have been approved and or rejected and for fluoride drugs meant for ingestion. Well, that's interesting. In 1975, the Food and Drug Administration allowed 35 drug applications to be voluntarily withdrawn. They don't think that's rejection. They said, get that out of here because we're not going to approve it. Oh, we'll voluntarily withdraw it because there's no substantial evidence of drug effectiveness as prescribed, recommended, or suggested in the labeling. So you can get dental fluorosis from swallowing those tablets. And that's one of the things when you actually look at the literature, that's what the literature shows, is whenever they give kids tablets of fluoride, kids get dental fluorosis. And no new drug applications on file. In the past, there have been fluoride lawsuits, and people say, well, this is such a tragedy, we should sue them. And they did. And 3 different courts in 3 different states, Pennsylvania, Illinois, and Texas. One trial lasted 11, then 14, and then 40 days, and they had expert testimony, ample expert testimony, and not one scientist promoting fluoridation could come up with any that solves this issue. A broad-based blinded study showing a significant reduction in permanent tooth decay. Not one. And all 3 of the courts determined that it exacerbated existing illness. What if you have a low thyroid? What if you have dental fluorosis? What if you have bad joints? Causes adverse health effects. All by itself. It causes some people to react adversely, and it contributes to excess cancer death. That's different than causing cancer. It may actually do that too. But all 3 courts determined that it contributed to excess cancer death. Unfortunately, all 3 of those injunctions were overturned at the higher court because we have elected deciders. You remember, I'm the decider? Well, that's what happens in a democracy. You elect a decider. And the court said, no, you've elected a decider. The deciders get to decide. The court doesn't get to decide. The deciders get to decide. But the findings remain intact. So when the dentists say, well, no court's ever found fluoridation harmful, that's not true. Courts have allowed the deciders to decide. And even the advocates for fluoridation have dosage schedules that will make your eyes pop. You know, how can you possibly have a 3-year-old kid run around all day in Las Vegas and drink 1 cup of either orange juice or 1 thimbleful of white grape juice or all day long on a nice hot day? Because the dose is actually the issue. We know what dose causes harm, and that you get over that, you're in the harm area. So we're recommending harm. And once you put it in the water, it's in everything. It ends up in the Gerber's Graduate Berry Punch from the pesticide on the grapes, but it ends up in the Minute Maid orange juice from reconstituting it with fluoridated tap water. It ended up in the Coca-Cola from the pesticide on the syrup. So it ends up in the Wheaties because that's made in a fluoridated community. And anytime you process foods, all your processed foods, Bill Maher is right. When you go to the grocery store, don't go down the aisles, only go around the outside edge. Only the fresh stuff is suitable for human consumption. Everything in it's in a box or a can except the beer. The beer's okay. But the box or the can is going to be high in pesticide residue and garbage and preservatives and all manner of icky things. This is one of the reasons that I declined the beverage of choice at the IAOMT meeting. A lady lived in Kansas City, Missouri, suburb. It's called Independence, and she had to go to the doctor a number of times over a period of 4 years, complaining about how her lower back hurt. Does anybody have anybody in their practice whose lower back is painful? Quit lying. Get your hand. Everybody has. I think 1/3 of the women in the United States today complain of lower back pain, and that it was determined that the reason for her lower back pain was that she loved to have Lipton iced tea, and that Lipton iced tea is a concentrate of the tea, and so there was fluoride in the water of Independence, Missouri, so you get the additive effect, and that's been published in the peer-reviewed scientific literature. It was not that surprising because that's actually the predictable outcome. We filmed a documentary. Betty and I went to China in 1999, and this is the pelvis of one of the ladies that we examined who is so crippled with skeletal fluorosis, she can't get off the bed. And you've seen dogs that ate kennel ration or one of those dog foods that had ground bone meal, that the dog's back legs don't work. It's the same problem. The fluoride causes the spinal column to encroach on the nerves that affect the legs. And so this lady ended up paralyzed, as the lady in Kansas City almost did, as many dogs and pets do. And that if you go to the veterinarian will give you the science diet. And the science diet, the secret of the science diet is it's meat. And meat is low in fluoride. And this is a young guy that used an hibachi to dry the corn. He lives in, this is his standard living is fairly low, and they raise corn and they have to dry it. And the way they dehydrate it is by burning coal, and that's inhaled fluoride. So any way you get fluoride into your body, and people say, oh, I drink bottled water. I'm sorry, don't you shower? Don't you bathe? It goes through your skin too. It goes through your lungs. So it can go through your stomach, or it can go through your skin, it can go through your lungs. There's no form of fluoride that's good. This is a gentleman from our documentary, and Dr. Gao behind him is pushing his head to the side, and the next thing he says was, stop it! Because it doesn't move. She's happy because she got the water fixed, and now she can't stand up, but she said the pain went down so much she could get off the bed. This is 20 years after she was poisoned at age 20 at 4 parts per million. That's what the National Academy of Science just rejected. In the United States, still today, you can have water supplies that are 4 parts per million, and they consider that perfectly safe. Well, this lady didn't consider it safe because it crippled her by the time she was 20. And so, and here's relative toxicity. And, so if I recommended that your child start brushing with an arsenic toothpaste, you would think I was not really logical. And so fluoride is just a hair less toxic than arsenic, and a lot more toxic than lead. And what's funny is that I'm old enough to remember, what little I can remember, is that I used to brush with a lead toothpaste. You remember the tubes that you rolled up and they stayed rolled up? Now we got the ones you roll up and they unroll, and you roll up and unroll. Well, those were lead tubes. And you can still get those, but you have to go to the dollar store. They're from other countries. And this is exactly what Herbert Needleman said about the children's poisoning study with mercury fillings, is that we're going to find that the continuum marches to one side. You can have an enormous level of exposure to fluoride, and they say, oh, that's okay. But here's the IQ studies, and that they lie about those too. But what happens is, if you look, you lose all your genius. And that's really good, because we can have a lot more people to push the broom around, because I noticed there was quite a bit of debris in the corner, so we need a lot more broom pushers. Maybe that's why industry has left America. What do you think? Adverse health effects: cancer, dental fluorosis, hip fracture, thyroid suppression, gastric upset, neurological impairment. Boyd Haley and I were on a bus in 1994 in Germany, and he was holding his tummy and groaning and moaning. And I said, "Did you bring your fluoridated toothpaste with you to this conference?" And he said, "Yeah, I did. And got up at 4 o'clock this morning, and yada, yada, yada." And I said, he said, "Do you got any Tums?" And I said, "Oh, Tums, let's see. Alzheimer's researcher looking for tablets of aluminum. Oh, what's wrong with this picture?" And I said, "Well, let's see. If we put some aluminum on it, well, you could get some aluminum fluoride, and that would probably be less toxic than the hydrofluoric acid that you're getting off the hydrochloric acid. Yeah, let's see if we can find some aluminum." And next time I saw Boyd, he'd done the calculations himself, and rushed up to me in Tucson, and he said he owed me a beer. I collected it because he decided to switch to a non-fluoridated toothpaste and had solved decades-long stomach issues. So that's well documented. So once I take away the only thing they've ever given you to stop tooth decay is fluoride, right? So once I take that away, what I find is a lot of people are flopping around in limbo like a fish out of water. Because what am I going to do? I don't have anything I can do for this person. Well, I have them brush with arsenic and use that lead toothpaste. That'll work. And what am I going to do? What am I going to do? And here's a lady in Puerto Rico that got tired of seeing babies come in with rotted teeth all the time. And so she had them come in and they used povidone iodine, and they dab, you know how kids at 8 months to 18 months, look like a rabbit? And so they came in and they dabbed those teeth 6 times a year. I mean, that's not brushing every night, is it? And they're using a 10% solution, and they used the 4 part per million fluoride from tea, and they used water, and they used distilled water. And none of the others had any effect, but the povidone iodine knocked the expected tooth decay down an enormous amount. Betty and I flew up to see my good friend Murray Vimy in Calgary. It's the only time I've ever flown for a prolonged period of time through ice and snow. Thanks, Murray. And it was September. It gets kind of cold up there, so every time I talk to Murray, I ask him how the weather is. And he says it's quite warm today. It's 31. And so we have a good time and enjoy our academy, because there's just a whole bunch of good things happening. And I'm totally with you, Murray. We need to declare a victory. We've already proven that it's harming the babies. Don't you think we ought to stand up and declare a victory? Nope. Our concern for the health and well-being of the children of this world, as dentists, we recommend no exposure of babies to fluoride if it's avoidable. And that if there is a problem, that there are alternatives that involve simply measuring the presence of the bacteria that cause disease and killing it with something that's a nutrient, like Lugol's or iodine, or have them in your office and rub their little teeth down with something that kills germs and not kids. And that's basically what I want to tell you. You can get these DVDs. We now have 2, soon to have 3. DVDs that are for play on public access, and you can take all of this information, our documentary from China, our crippled horses, Christopher Bryson talking about how the deception started, and play them on your public access TV. You are entitled to go play videos on your public access TV, but they can make you jump through hoops. Well, we're doing the hoop jumping for you. All you got to do is go down and say, I am a producer. I have 12 programs I would like to play. They say, okay, be here Saturday to take a workshop, and then when you get to be anointed as a workshop graduate, they will give you a time slot, and you can play all this information in your community. And I call it immunizing your community. You can show your community what you've learned here. You can show them what the information, what the science shows, what's the research shown about the benefits of fluoride. We got smoking teeth in that format, mercury. We got safe removal. And so you can educate your community One of the videos I showed last night was called Bad Bugs, and that's about how to stop gum disease. Show your community what biological dentistry is about, and you've taught the public. You know how Murray was talking about numbers? Well, we got to get the numbers. Ad in the New York Times cost $67,000 for a full-page ad in the New York Times. And I don't think they'll see the classified ad in the back. So we can get the numbers if our members will simply either assign a person to their office or go there themselves and use the tools that we have available to us citizens and play it on public access. We've done the hard work for you. Just go out and play it on public access and educate and immunize your community about the benefits of biological dentistry. And I see we're ready for our next speaker. We're good? 5, 10?
We started late, so.
You tell me what you need, because I can either talk for about 2 years or I can. This is one of the videos that we have available for your public access TV. Its old format was too long, and it's actually on the deck right now being cut down, and with a new segment added called Safe Removal. Safe Removal is a very simple procedure where you protect the patient, and you all learned it, and many of you are accredited in it, and that's how you educate your patients. Was having lunch today, and one of our colleagues says it's the most effective way to educate his patients was to put a television with a DVD player in the waiting room. And that he said it's really bad about being on time, so people are always picking up the DVDs and playing them and watching them. And when he comes to get the patients, no, wait a minute, I haven't finished this video. So they get a chance to educate themselves, and they get a chance to watch what you've learned at the Academy meeting over the last 25 years. And it's a wonderful way to bring the kind of information to your community and to your patients, and that we've got the tools for you. And that's really what I want to tell you. And go to my YouTube channel. You can search on David Kennedy DDS on Google. Google that on YouTube, or do a search on YouTube. And my Gmail is davidkennedydds@gmail.com. And you'll find my channel. And what's interesting is the channel will always, you'll find there's a number of videos there. And if you go Smoking Teeth, that YouTube gives you all these suggestions, about like smoke enders and whatever. That's not my suggestions. My suggestions are the ones up above. And those are the 14 videos that we have already on YouTube. Those are little pieces of bigger videos. Many people don't understand. That's why it says excerpt, is that there's a longer video that's available on DVD format for you to play in your local public access TV. You can see a preview, or I call it Cliff Notes, on my YouTube channel, and it's basically a summary of what the longer program's going to show you. And so you can get on there, take your pick, watch it, refer it, email it to your patients. And if you're not sending an email newsletter to your patients, you should be. And then periodically put a link to one of those videos. And that they will go on there and you can talk to them. If you sign up to be notified when there's a comment on there, if you see a comment on there that you want to comment back on, you just click on your browser and it takes you right back there. And so all of a sudden you're part of the conversation. You don't have to be a Twitter or Facebook. You can even be anonymous if you want to be. And that's the beauty of the internet. I've spoken to over 340,000 people from one of the videos. One of the videos, 340,000 people. We couldn't get them in this room. It would be really, really crowded. I haven't spoken to 340,000 people in the 25 years I've been lecturing. So how did I do that? I put it up on YouTube, and numbers keep rolling up every day. I see more people on the internet than I see in the meetings, and that's one of the reasons that is driving the dentist crazy. It's proven, it's done. We should declare a victory, have a victory celebration, and I think I'm done with fluoride. Anybody? One of the issues is somebody was saying, well, but what's the real science? Well, the National Academy of Science has reviewed fluoride 3 times. 2 times they had only the people that thought fluoride was good on the panel. And so 2 times they came up with some very interesting conclusions. The most recent time, they had 3 people on the panel, Bob Isaacson, Kathy Thiessen, and Hardy Lineback, that didn't think fluoride was all that good stuff. And there were 12 people on the panel. But those 3 people got the panel to vote unanimously to reject the public health goal for fluoride. And were able, through their efforts, to include a whole bunch of scientific literature showing harm to humans at dosage levels well below what we're receiving. If you meticulously avoid fluoride every way you know how, you still are dosed above the level that's known to cause harm. So the science is clear. If you send me an email, I'll send you a link to get you an entire email copy of the National Academy of Science. And break their copyright. You paid for it. You own it. The government can't copyright their documents. So it's out there in PDF format for the entire report of the National Academy of Science. And I had a wonderful opportunity to debate a young lady after the last meeting in North Carolina. I flew up to Timberville, Virginia, and they were going to talk about fluoride in the water. And they had the public health dentist and then myself, and we were very cordial and so forth. And she said the usual proclamations of safety. The National Academy of Science has determined there is no research whatsoever that's ever found any harm to human beings at the level that's found in water supply. And I had to correct her. I said that, ma'am, the level in water supply is not a dose, that is a concentration. And that, you know, if it said that someplace in that document, I'd sure like to see it, because I've read it from cover to cover. And I see you have a very, very dog-eared version of it right there in front of you, and you've obviously read it too. And she said, well, I was paraphrasing. And I said, well, let's paraphrase. How did it affect the thyroid? What was the dose that affected the thyroid? And she said, I don't recall. And I said, can I borrow your book? And she said, yes. And that God reached down and opened that book to exactly the page with the graph of the levels that affect thyroid. And she bookmarked it and highlighted it. And I said, oh, I see, your memory's not what it used to be. Because right here, and I helped her calculate the dose. And then they said I was being too argumentative. But I can be that way. She was a little embarrassed. I think I'm done.
Okay,
Dr. Kennedy?